All right. Well, let's go ahead and get started. My name is Jenny Garrison. I'm the Outreach Program Manager for the Maryland Health Connection, and I'd love to welcome you all here today. We are just 2 weeks away from open enrollment, and we're really excited to take this time to kick off our season of open enrollment with you all today. And we have some very exciting and informative updates that we'll be sharing. And first, I'd like to introduce you to our presenters today. As you can see, we have Michelle Eberly, the Executive Director from the Maryland Health Benefit Exchange. Also with us today, we have George Escobar, who is the Chief of Programs and Services for CASA. And we have Ruth Getachew as well today, who is the Director of Consumer Health Coverage Assistance, or the HCAT team with the Maryland Insurance Administration. And just to give you an idea of our agenda for today, Michelle will be giving an overview of Maryland Health Connection. She'll talk about the new eligibility for DACA recipients, and George will also highlight the importance of the DACA eligibility for the Maryland residents who receive DACA. And Ruth will also talk about the new health coverage assistance team. I'll give you a few tips for sharing open enrollment information with your community, and then we'll open it up for Q&A at the end. And as Tim mentioned, if you have any questions, please leave them in chat, and we'll be happy to answer them at the end of the presentation. Sound good? All right, let's go ahead and get started. I'm going to turn it over to Michelle Eberly, our Executive Director. Welcome, Michelle.
Oh, thank you so much, Jenny. And thank you, everyone who's joined us today. We have over 70 people on this call, so I'm just delighted. Our team has been working hard all year long. As you know, before we get to open enrollment, there's an awful lot of that work that goes on the entire year prior. So we're really thrilled to be here today to tell you things that are new. And I know some of you on the phone have been around, so you know a lot of this, but we also know we have some new folks. So I'm going to kind of level set, and then we'll go into things that are really new and exciting for this year. Maryland Health Connection, as you know, is the state's designated health insurance marketplace, and it's administered by Maryland Health Benefit Exchange. So you'll hear those two names sometimes interchanged. We were established in 2011 under the Affordable Care Act. And since then, we've worked tirelessly to fill our vision of high quality, affordable health coverage for all Marylanders. You can access Maryland Health Connection through our website, which is marylandhealthconnection.gov, or our mobile app called Enroll MHC, and that's available in both Apple and Google stores. And then we have personal consumer assistance that we provide through our call center, through our navigators, through our licensed authorized brokers, and our call center has over 200 languages available. So we have in-person and virtual assistance throughout the entire state that is at the ready to help you and your consumers and constituents and neighbors and friends get enrolled in health coverage. Next slide, please. Now, one thing about Maryland Health Connection that if you've been around, you know this, but I'm going to restate it. It is the only place to get financial help. So good chance that someone who gets coverage through Maryland Health Connection will be able to secure some financial assistance. And in fact, in 2024, the average customer who was buying a private health plan was able to receive $388 a month on their towards their premium, thanks to our increased tax credits that were afforded through ARPA, through other premium assistance through the reinsurance program. So again, making health coverage affordable is one of our tenets, and we're happy to share that through Maryland Health Connection. Next slide, please. Now, there's other ways as well, in addition to those premium tax credits, to get some financial assistance. We also offer Medicaid coverage and Maryland Children's Health Program. So those that qualify for free coverage or low cost through Maryland's the CHIP program can get that through Maryland Health Connection. We're very fortunate in Maryland in that we have an integrated eligibility and enrollment system. So you don't have to be worried about what coverage might I be eligible for. You come in, enroll, and we will guide you to the appropriate program based on your income and other factors such as where you live. And again, tax credits, I talked about those a couple times, but we also have cost sharing reductions that are afforded to those that qualify, and that's through our silver plans. And again, those cost share reductions help lower the out-of-pocket costs, your deductibles and such, so that again, there's more value in the health plan you're purchasing because you're getting more first coverage service without having to pay for it. Next slide. We have just a wealth of carriers that are offering coverage. This year, new to the exchange is WellPoint. And what's really exciting about WellPoint is that they're the first carrier that has transition from serving on Medicaid as an MCO and has now put their foot into the private commercial market space in the individual market. So we're really excited about that. We also have Aetna, United Healthcare, Kaiser Permanente, and Care First. And again, many of those carriers also participate in Medicaid, so that unified system I'm talking about, whether you're transitioning from Medicaid into a QHP, you will be able to have continuity in terms of staying with that carrier, which is a real valuable thing in Maryland. Next slide, please. So what do we cover? Every single plan we have through Maryland Health Connection covers essential health benefits. Those were defined by the Affordable Care Act. They're required. So in order to participate through the exchange, you have to provide those covers. Doctor's visits are covered. Preventive care like flu shots, cancer screenings, they're covered. Emergency care, mental health care, prescription drugs, all of that is covered service. Many of those services are pre-deductible and zero cost share. So you can get that wellness. What's important to the exchange is that we want Marylanders to be well and manage chronic conditions before they become out of hand. And in fact, in our mission, it talks about that we improve the well-being. Our goal is to improve the well-being of Marylanders. And we do this every day by making sure the benefits we offer in the health plans are meaningful for consumers. Next slide, please. So what has our impact been? This has really been a fun slide that I've been able to talk to folks around the state about, because we've been doing this now for 10 years and everyone says, well, what's the impact? What's happening by having these health plans through the exchange? One thing, we've been able to keep them very affordable. We had in 2019, we instituted the state reinsurance program that led to a 30% reduction in premiums. And that continues to afford Maryland residents the lowest bronze and gold health plans, the premiums for those plans in the nation. And we've continued to hold that record for several years now. We also, in 2021, the American Rescue Plan was enacted. This allowed or afforded greater tax credits for consumers purchasing health insurance, and also allowed income earners of any income to avail themselves of the tax credits as long as they did not go over the percentage of their income that was payable towards health plans. After that was implemented, we saw an increase in 11% on average over a 3-year period. Now, this past year alone, post the Medicaid public health emergency, we were able to provide a safety net for Marylanders who had been getting free health coverage for several years. We were able to enroll them into commercial products, again, low or no cost. And what we found was we had a 17% increase in our enrollments. Now, not all of that was due to the public health emergency unwind, but we were really excited that, again, we had that safety net program, a place where people could fall and still get health insurance. Now, again, talking about outcomes. So that's how we've kept these plans affordable. But what's the outcome been? I have a picture up here on the left of Shelley Eldridge. She's been kind enough to do a video for us. She's on our website in her video. She's the founder of Visions Creatives, and she credits her ability to start a new business because of the affordable health coverage she found through Maryland Health Connection. It allowed her to not worry about her health, have affordable health coverage, and then put all her energy and her time and her funding into starting a business. Carmen, can you mute yourself? Thank you. I recently was at a community forum where Senator Cardin was there, and he was boasting about Maryland having a 34% increase in small businesses, and particularly small businesses for women. So I was able to share this story and say, look, this is exactly what we're intending to do. Improve the economy in our state because people have health coverage. Now, another really interesting impact is, and this is something we just came upon this summer. We've been waiting for researchers to conduct their studies and really tell us what they found. Well, there was a study released on June 1st of 2024 by the American Surgeon. It was based on research done by our own Howard University Medical School and the Alabama Medical School. And they focused on diabetes in Maryland, specific to Maryland. And what they found was that post-ACA, amputation rates dropped from 56% to 23% after the ACA implementation, and revascularization rates soared from 44 to 77%. Now, we know that diabetes causes amputations of the legs. It's highly related. We also know that diabetes affects certain communities in Maryland more than others. So their study found that the broader insurance coverage, particularly to more basic routine care, led to better outcomes for folks. And I'd like to, again, just state that I think the work that Maryland has done, Maryland Department of Health has done a lot of focus effort around diabetes, and the exchange has done a lot of work on our value plan benefits, trying to get, again, first dollar coverage for treatments needed for diabetes. So that just shows the outcome of how important what we are doing is. So now let's turn a little bit to open enrollment. The next slide, please. Here we are back to our open enrollment. Starts November 1st. It will go through January 15th next year. And again, it's going to be fast and furious, as it always is. The good news is that our system really does help get people enrolled. And again, you can go get an estimate today and see what you and the folks you assist, what's available. And we are here to help. Jenny put up the slide, Maryland Health Connection, our call center number, Broker Connect, and our consumer assistance that I spoke about earlier. The next slide just shows you a little graph of where those folks are located. So you can see that. And then I'll go quickly into some updates for the 2025 plan year. These are some new things this year that we're really excited about. Again, young adult subsidy, we're going to be able to continue this through 2025. Been a just hugely successful program. So anyone that between the ages of 18 and 37, they will be qualified for that based on their income. And again, on average, we're seeing about a $38 a month addition to help folks afford their premium coverage. And next slide. This slide just gives you a little demonstration that shows, I'll just take, for instance, a 25-year-old in Baltimore City. They can actually get a $0 gold plan, the lowest cost gold plan, after application of that young adult subsidy. So, that's a really high, richly benefit plan for no cost. So there's no reason our young folks should not be coming in and getting health insurance, because it really is affordable. Next slide. Probably the most exciting new item, and we have George here who's going to talk a little bit more right after me on it, is our new coverage for DACA recipients. And we're just thrilled about this. Maryland has been collaborating with our state partners to find ways to cover more Marylanders. And as you may know, we worked with the legislature last year to be able to amend one of our federal waivers to allow all Marylanders, regardless of documentation, to be able to enroll through the exchange. That will not be ready until next year, 2026. But this year, the federal government did update their definition of lawfully present for the purpose of marketplace eligibility, and it now does include anyone who received deferred action for childhood arrival status. So starting November 1st, DACA recipients will be able to use Maryland Health Connection to get a private health plan. They will be able to get subsidies because they are deemed lawfully present. And we are ready to get them into coverage. Coverage for them would be able to start November 1st. Or again, for the next health year. So just really thrilled about that. And again, applying for DACA recipients who apply for coverage, it will not have any impact on anyone else's immigration status. Now, I do want to mention that there is currently an active lawsuit ongoing, fighting against this rule. We are moving ahead until we're told that the rule no longer is legal. We will continue to move ahead. So I'm going to stop here and I'm going to turn it over now. I'd like to introduce George Escobar, who's a Chief of Programs and Services from CASA of Maryland, and he's going to talk a lot more on how you can help us connect DACA recipients to coverage. George, welcome and thank you for joining us.
Thank you so much, Michelle. And again, thank you so much to the MHBE, and thank you so much to the leadership under Michelle Eberly. Every opportunity you all have had to expand coverage to more and more Marylanders, you have taken the opportunity, you've embraced it, and you've assembled a team that's ready to take on the additional challenge. So again, thanks to all the great staff at MHBE, and thanks to the leadership of Michelle. Really, you guys are a national model in how to embrace these changes and prepare for these to cover more people with healthcare. So I wanted to talk today a little bit about. It's worth kind of jumping off from that point that Michelle just introduced to talk about what this means to the community itself. A look back at who this community is, really, that we're talking about, and what it signifies to a really important part of the immigrant community, which are those individuals that are documented. So next slide, please. So real briefly. It's a worthwhile exercise to look back exactly at who this population is, right? And what is DACA? DACA, many people on this phone call are probably really familiar with this community, but it's a good opportunity right now to remember what it is and what it isn't, and who would be eligible to apply for health insurance under this new rule and who wouldn't, right? So real briefly, as you remember, DACA really harks back to the Obama administration's attempts at immigration reform. This was a temporary program initially that was initiated over 12 years ago as a step to get us towards more comprehensive reform, right? So this was a program that really provided immigration deportation protection to a very specific population within the immigrant community, right? The initial rules, and again, this was initiated in 2012. The official name is a Deferred Action for Childhood Arrivals program. We all know it by its acronym, DACA. Really specifically, if you remember back, the eligibility that was initially placed continues to this day. So the DACA population is a very finite population, very specific. So these same eligibility criteria continue to hold, and only those folks that were initially able to apply during that initial enrollment period are the ones that are eligible to renew. So that population hasn't grown, On the contrary, it's starting to contract a little bit with the passing of the years, right? So again, these are folks that arrived and really grew up in the United States, arrived in the United States as children. That was the intention, and they grew up in this country. So from the beginning, they had to prove that they entered into the United States prior to turning 16 years of age on a specific date, which was June 15, 2007. So that was exactly 5 years prior to when the Obama administration made the announcement in June of 2012, right? So all of these folks had to submit a variety of very complicated, had to go through a very complicated process. They had to submit all this paperwork showing that they entered the United States before that particular date. There was a cap at how old they could be when they initially applied at that time. So they had to have been under the age of 31 on that time at that point when they applied originally in 2012, and they had to prove that they were either matriculated or attending a high school, college, employed, or a veteran, and that they had no other immigration status available to them, right? So really finite, folks. That really means that today, 12 years later, the majority of this population is like around mid-30s, getting very close to that 40 number. They're getting close to the 40s, but most of the population is in that area, like basically within that decade of like mid-20s to mid to late 30s. Initially, around, although the estimates were higher at the beginning, but initially, and to this day, about 900,000, so less than 1 million people nationally benefited from this. Really diverse. We always think of immigrants coming from one particular country, one particular part of the world, Latin America, right? But honestly, and according to USCIS information, very diverse population, over 200 countries of origin represented through that in that figure. So we're talking about people from Africa, we're talking about people from Asia, we're talking about people from all over the Americas. As I mentioned, that population is starting to decrease a little bit. Some people have been able to regularize their, some people have married U.S. citizens and been able to transition into resident status. Some people have left the country. Some people have just not renewed their DACA. So that original 900,000 figure is now around 580,000, according to the last statistics available. And again, this is nationally. So a little bit over 500,000 people are DACA beneficiaries. When I say DACA beneficiaries, that means that they have DACA today, right? And what does it mean to have DACA today? So as I mentioned, it allows you protection from deportation. It's only a 2-year permit. And that permit allows you to apply for employment authorization. So they're allowed to work legally in the United States. They pay taxes, and we're gonna talk a little bit about what the profile looks like of those individuals. But it allows them, this DACA allows them to apply for employment authorization, have a regular job, and protects them from being deported. And they have to renew every 2 years. If they do not renew every 2 years, they lose their status, and it's very difficult to apply again and regain their status if they had lost it, right? So these are folks, many of these folks for 12 years now have been renewing, and we're talking about 12 years. A lot of folks have renewed 5-6 times at this point, right? In Maryland specifically, we're talking about, a lot of this population is really concentrated in the larger states of the union, but in Maryland we have around a little bit over 7,000 folks. We at CASA have helped about half of those apply for status and renew. And if we go to the next slide, we'll look at a little bit of what that community looks like today, right? This is information, really great information that was done by the Kaiser Family Foundation, really looking at census data. And so this gives you a good idea of what the DACA population looked like nationally. So through surveys, through different demographic analysis, we know that 64%, because they're on the younger side, they're defined as excellent to very good health. So again, this is not going to be a burdening on the healthcare system. On the contrary, an addition of these folks is really going to help us to address some of those other issues that Michelle just talked about, right? we might even see a lowering of overall costs because we're talking about a healthier community that's moving on. That'll be joining the QHPs. We see that they're highly employed and they're very active in the workplace. 84% report that there's at least one full-time worker in the family, in the household, right? But about half of them, 54%, and then this goes into some of the economic challenges that they have. Probably about 54% report only working full-time. So many documented individuals experience the same things we see in other parts of the immigrant community. Multiple part-time jobs to be able to pay their expenses, etc. Folks that are and just as a reminder, these folks, they're documented, they have employment authorization, but they're not eligible for the wealth of public benefits that a legal permanent resident, that a citizenship is eligible for, right? So these folks are not receiving a lot of return on their investment and their contribution to taxes that we all benefit from, right? About 41% report having some college or higher. That tends about near what we see on national averages. 40% are already parents. Again, these are folks in their 30s, their late 20s. And again, nearly half, 43%, report being below 200% FPL. So again, indicative of what they really look like, of their challenges, really being able to retain full-time employment. We're talking about only employment authorization in 2-year periods. They have to continue to renew. Sometimes employers are hesitant to bring those folks on because something could happen and they could lose their employment authorization, right? So all these factors contribute to some of those demographic analysis. And so we see the uninsured rate is almost half. 47% of documented folks are currently uninsured, right? Our national uninsured rate around 82%. So this is a huge momentous moment in that community, and an opportunity to really address those disparities, right? Next slide, real quickly. So in the next slide, just wanted to put a face on what that community is. These are two a little bit random examples of like two documented leaders that we have within our organization. I mentioned that documented folks represent a significant part of CASA's membership and have been working with us for a very long time, right? So we have a lot of examples like this. I just wanted to share a couple that really struck a chord with me because they're exemplary of how many experience and how many come in and out of our health coverage, of the many health coverage options we offer, right? And what they're eligible for, what they may not. So one example is Fatima. Fatima is a 23-year-old mother, very young mother. She was born in Mexico, applied for DACA. She's had DACA now I think she's gone to her third or fourth re-enrollment. She was a benefit of the Healthy Babies Prenatal Program. This is a great program that was just instituted last year. It provides prenatal assistance and coverage for everybody, regardless of documentation status. So wonderful that she was able to participate. Wonderful that she was able to leverage that program that now Maryland offers, and her child was born thanks to that program, and she was provided support for that program. But of course, that program is temporary. That in terms of its coverage of the parent, right? After about 4 months, they have to graduate out of the program. So now she's a young mother, right? Still lactating mother. So her health coverage options are gone. She's definitely looking forward to applying for the QHP opportunity and the expansion of DACA, because now this makes her eligible to go into the QHP, right? Had it not been for this opportunity in November, again, we have a young mother who their child will have coverage, but she would not, right? Naomi is another example. This is another leader of ours who's been very much involved with the organization for a very long time. Unfortunately, she's a breast cancer survivor. She's a 30-year-old, again, applied for DACA 3 or 4 times. She had not received employment benefits from her employer, so she participated in various charitable health insurance programs. One that the Kaiser that Kaiser actually offers, which is a great program. It's called CHAP. And she participated in that program, but there's a cap on how many people could enroll there. She unfortunately lost her opportunity to re-enroll. And now she's left without insurance, right? And still has a treatment portfolio that she has to follow. And again, very much looking forward to her opportunity to apply for this, right? So again, two examples that kind of show very specific, but at the same time show what it's like to be a documented individual, right? Weaving in and out of various programs, and what this really signifies and what this really represents to that community, right? That approach to now having regular access to coverage through a qualified health plan that they are now eligible to receive a subsidy for, right? So very, very transformational in the lives of these individuals. And next slide real quick. So at the end of the day, this is a long-earned victory for this community, right? As we've been saying, 12 years of victories but of course a fight that this community has had since that great moment during the Obama administration, and now to this day. And it's a community we heard about. Michelle talked a little bit about the lawsuit, right? It's a community that's constantly threatened, constantly challenged, not only the benefits that they're eligible for, but also their overall status, right? DACA is something that has been continually in the courts and challenged. And so this is a community that continues to fight back and continues to withstand it all. So it's a community that's, because of that, right? A lot of silver linings that come out of that. They're a highly politicized, civically active community. They know their stuff. Right? They may not be eligible to vote, but they know politics, and they know what's going on in our universe, right? And it's a very active community. But this represents really the first time in which, it hasn't been about defending DACA. It's been about pushing forward. It's been about integrating them into our society in a much more comprehensive way. It's been about now bringing them an opportunity to receive healthcare that they've earned, that they deserve, that we're happy to work together to help them attain it, right? So it's a beautiful opportunity. Of course, you guys know, si se puede, si se pudo means it happened. So we're really excited to work with all the folks here on this call in making sure that that all folks are informed, are educated, and are navigated towards opportunities. We run we have health navigators as well. Work really closely with MHB to help people get enrolled. We have a Spanish and a French line that provides that type of assistance and helps people navigate their different options. And so the phone numbers are there. And I'm sure we'll be able to distribute this information so you guys have it. But really excited about these opportunities to work with partners such as the Maryland Insurance Administration. And now really, really excited to introduce our partner, Ruth Getachol, to talk about the great work they're doing.
Thank you, George. I appreciate both of your presentations. You guys have shared a lot of really good information and a lot of valuable and important information for the community this coming open enrollment. So I'm here with the Maryland Insurance Administration to talk a little bit about a newly available resource that we have called the Health Coverage Assistance Team, or more commonly known as HCAT. Next slide, please. So I wanted to take a moment to kind of do a little bit of background on who we are, what the Health Coverage Assistance Team is, and where it falls within the Maryland Insurance Administration. So the Health Coverage Assistance Team is a program within the Consumer Education and Advocacy Unit. It's a long name, but basically just the consumer-facing unit of the Insurance Administration, right? Which makes sense because the Health Coverage Assistance Team is really here to provide one-on-one assistance for individuals or individuals calling on behalf of someone else for those health coverage related questions, those health coverage related challenges or concerns that consumers are facing once they have their health insurance and they're trying to access healthcare coverage or healthcare services. So the idea here is that we are here to provide accurate information to the community, right? So we do so via webinars, presentations such as this, in-person and virtual events, one-on-one assistance, so talking one-on-one with consumers or with individuals about the specific challenges, the barriers that they're facing with regards to accessing healthcare coverage. Brochures, consumer advisories, the list goes on and on. But the idea is to really meet individuals where they're at when it comes to insurance, because insurance can be such a daunting topic, right? We partner very closely with the Maryland Health Benefit Exchange in order to get people access to the health insurance, right? But once they have that health insurance, we're really here to help individuals figure out how to use it, right? Next slide, please. So there are a few things that we wanted to focus on when we created the health coverage assistance team, right? So these are a few of our priorities. We wanted to make sure that we were serving as a widely used educational resource for individuals across the state who needed help understanding and using their health insurance, right? So that's what I was just mentioning, partnering with different agencies to really get that word out, do that education and meet consumers where they're at. And so we work with the Maryland Health Benefit Exchange quite a bit on webinars for how to get and how to use your health insurance. We also wanted to make sure that we helped individuals navigate those challenges, right? So specific situations or circumstances that affect their access to care. And this includes behavioral health services and treatment, but also medical and physical health benefits as well. And we wanted to use the information that we're gathering in this process to help inform MIA priorities and processes. So really, in a nutshell, basically using the information that we're gathering through those one-on-one interactions to then inform our processes and make sure that the services that we're providing are effective, right? And then lastly, exploring ways to help individuals who lack legal documentation access compensated coverage. Right, so with the current rules and regulations that are in place when it comes to health coverage, individuals in this population we know have a harder time accessing healthcare coverage. So the idea here, but still needing to access the healthcare system. So the idea here is to help this population of folks be able to access coverage that is either free on a reduced scale or get them linked to proper health institutions that can provide that sort of care for them. So those are the four main priorities when we were conceptualizing the team and our goals when implementing our services. Next slide. And so this slide talks a little bit about helping consumers regardless of their health insurance type. And this is important because for folks that are aware of the regulatory space in and around health coverage, the Maryland Insurance Administration regulates only about 20% of the pie when it comes to health coverage, right? And so that includes plans that are purchased through the marketplace, right? So through Maryland Health Connection, and that's those individual and employee-based plans. It includes plans like long-term care, dental, vision, and it also includes Medicare supplemental plans, right? So that's that 20% of plans that are being offered and used in the state. However, this team, although it's housed within the Maryland Insurance Administration, is here to help individuals regardless of their health coverage, right? So that includes Medicare Part A through D, that includes Medicaid, that includes veterans or TRICARE, self-insured policies, right? So either ERISA regulated or non-ERISA regulated, and those federal employee health benefit programs, contracts that are issued out of the state, right? So helping individuals get linked to those appropriate entities. And then uninsured and underinsured individuals, or just folks that don't necessarily understand or know what health coverage they have. So this team is really set up to help individuals regardless of their health insurance. And this slide just really takes a moment to detail what that looks like. Next slide, please. So I've talked a little bit about our background, why we're here, what we're here to do, but what do we actually do, right? We're here to work with the consumer or anyone calling on their behalf to answer questions about health insurance, right? How to get it, how to use it, And we work hand in hand with the Maryland Benefit Exchange, getting them connected to the Maryland Health Connection for how to get health insurance. We offer materials explaining health insurance. And those are some of those priorities that I explained as being housed within the Consumer Education and Advocacy Unit, right? So we do so through various platforms, in person and virtual. Understand the person's specific concern, right? So being able to listen to what's happening to that specific individual, understand the challenges that they're facing, the barriers they're experiencing when getting healthcare services through their health coverage, right? And then suggesting next steps to address it. And like I mentioned, right, the Maryland Insurance Administration regulates that 20% of the pie, right? So oftentimes what our role looks like is connecting the person to the right entity to help them, right? So what we've done is taken time to really understand the protocols and procedures when it comes to these different coverage types, how to file appeals, how to put in a claim, how to do a pre-authorization, and we can help streamline those processes for individuals that need help with those things, right? Provide education and then get them connected to the appropriate resource. And then lastly, explaining how to file a formal complaint or grievance. And then for those plans that are regulated within the MIA, doing that internal follow-up, right? So all of this to say, just to really hone in on the point, HCAT, or the Health Coverage Assistance Team, is really here to be an ally, right? We want to walk with the consumer through this journey because it can be a journey in order to get health coverage for the services that they need. And so we want to walk with them as long as they have us, until their questions are answered and their concerns are addressed. Next slide, please. So this grid also available on our website, which I'll give details to at the end of this, just goes over what I basically explained in a visual depiction, right? Because visuals are always a nice thing to have. So what we're seeing on the left-hand side are the services that I mentioned. So answering questions, offering materials, etc. And then on the top, you see the various coverage types that I mentioned 2 slides ago, right? So those individual plans, those employer-based plans, Medicaid, Medicare. And you see the throughout the grid, how we can assist. The only no's that you see are in the bottom right-hand corner, and those are for the plans that we can't do MIA internal follow-up, just because those are the plans that aren't regulated by the administration. Next slide, please. Alrighty, so here are some real life examples of coverage issues that affect consumers' access to healthcare that the Health Coverage Assistance Team would really be a good resource for. And I'm sure that all of you that have worked with individuals that have access or had barriers accessing care have heard some of these, right? So first one being, my health plan says that the services that I need aren't considered medically necessary, right? I've received a bill for a healthcare service that was supposed to be covered under my health plan, but isn't being covered, and I'm getting that bill. So what do? How do I move forward? I can't pay this. I don't think my benefits cover the mental health and substance use services that I need, right? And lastly, but probably what we see the most, is that the provider I need to see isn't in my health plans network. And we see this a lot, particularly with those behavioral health, so mental health or substance use treatment services. So in these situations, right? Next slide, please. In these situations, the Health Coverage Assistance Team can be used as a resource to help individuals navigate those processes, right? Again, just really honing in on the fact that this team provides one-on-one assistance to consumers and stays with them until there's some sort of resolution, right? So either we filed the appeal and we've gotten all the way to the point where we're going through the complaint process. The Health Coverage Assistance Team is going to stay with that person and help answer questions along the way, help them navigate what those next steps look like, and make sure that they feel supported through that process. So individuals can contact the team on behalf of themselves, right? They can contact us directly, but organizations, agencies, advocates on individuals' behalf can also reach out to the team in order to get assistance when helping that person, right? So we're here to not create an additional barrier. We want to help individuals that are helping others or help others directly. And so we work with partner agencies and organizations across the state because of those referral pathways, right? So making sure that they have an ample referral pathway to us, but also us having an ample referral pathway out because of those plans that I mentioned, us getting them connected to the appropriate entity. And we do making sure that we're available as a resource, but also doing trainings with different groups that are interested in learning a little bit more about insurance so that they can better help their individuals and their consumers as well. Next slide, please. So this is contact information for the health coverage assistance team. We can be reached either through phone, which is manned Monday through Friday, 8 a.m. to 5 p.m. And you can always leave voicemails, and those will be received and responded to within 1 to 2 business days. We also have an email, a shared email address where all of our questions can come in and get assisted to by one of our health insurance specialists. And then lastly, we have a web form available on our website that has some simple demographic information, just really your name, your phone number, and what assistance you need. And then a specialist or someone on our team will be reaching out within 1 to 2 business days. And that's all the information that I have for you today. So I'll hand it back over to Jenny to close us out.
Thank you, Ruth. Thank you, George, and thank you, Michelle. I think this was really informative and a lot of valuable information. And thank you to everyone who's joined. I just wanted to share a couple resources that the Maryland Health Benefit Exchange has available for you so that you can reach out to your community members. And you can always reach out to me at any time if you need help getting someone connected, and I can get you where you need to go, whether it's to Ruth or George or to another, to possibly even just to a health insurance navigator. I'm happy to be that connection for you. We have a really awesome site. It's thesocialpresskit.com/Maryland Connect. A lot of the images that you saw throughout the slides are also social media posts that you can kind of click through and download and put right on your channel if that's how you commonly communicate with your audience. We have them available in English and Spanish and on different topics, open enrollment. We also have a new mental health content that you'll start to see showing up on our channels because we recognize how important it is to share the mental and behavioral health coverage that's available through our plans. If you would like to, I can work with you to get information for your email newsletters. I can mail you brochures or rack cards or giveaways. And if you're having an event, we can send you materials. We do a lot of speaking engagements, and we have a fact sheet library, which is available at marylandhealthconnection.gov/resources and fact sheets. If you have an idea that you would like to do, drop it in chat, and we are happy to work with you on raising awareness. I mentioned that we're really focused on mental health coverage that's offered through our plans, and we're having another webinar that we hope you will join on October 30th at noon. And we will have a speaker from Ruth's team talking more about the health coverage assistance team, and they're going to dive a little bit more into some of the out-of-network coverage that you can access for mental health coverage, which we know is a common concern. Our colleagues at the National Alliance on Mental Illness will also be joining us to offer resources for individuals seeking mental health coverage, and we'll be there as well to talk about what's available through plans. And I see in the chat, some of my colleagues are adding some resources for you, the fact sheet library and the social press kit. So click on those links so that you have them open in your browser. I also wanted to let you know that we're hosting about 40 events during open enrollment where you can recommend that one of your community members goes to sign up for healthcare. These are free events. Many of them are resource fairs as well. So they're offering things like free food and other agencies and nonprofits are coming to talk about their services as well. These events are also listed on our website at marylandhealthconnection.gov/events. As I mentioned, we're going to get you a copy of the recording and the slides. Here's my email and my cell phone. Please feel free to reach out to me at any time. I'm happy to help you, and it's also my job to help you get your community members connected to healthcare. And we have all these connections and resources, so we're really happy. And now I want to open it up for a Q&A. I did see a couple questions come in, so I'm going to scroll back up. And the first question is, this one I believe is, it was popped up when George was speaking about the women who were DACA recipients and why do they have to wait until November to apply? Maybe Michelle could answer. Why would DACA recipients have to wait to apply for coverage even though they had lost their other healthcare coverage?
The rule does not become effective until November 1st, and the first effective date they could get for coverage would be December 1st. So that's just by when we are able to implement this according to federal guidance.
Thanks, Michelle. And I think Betsy did answer this question. Do all QHP plans cover vision benefits? Michelle, did you want to elaborate on the vision coverage?
Sure, I'm happy to do that. And Betsy did put it in the chat as well that CareFirst has a vision plan embedded in their plans using Davis Vision. Kaiser Permanente and United Healthcare have specific plans that have basic vision embedded. VSP is our only separate vision insurance, and you can access them through a link. And that's, if you want some additional coverage, they cover, a little bit more. Or if you don't have any coverage at all, you can get a VSP plan.
And Andres wants to know, how can I contact George for additional information on CASA?
I already messaged him, but happy to put the contact information for everybody.
Okay, thanks, George. Let's see. Thank you for the switch to Zscaler login. It is much more navigable and makes it easier for me to help people. Awesome. Is there a penalty for switching out of Maryland Health Connection into insurance required by full-time employer? So would there be a penalty if you closed your Maryland Health Connection plan to move into an employer-sponsored plan? Michelle?
No, there is no penalty if you terminate your coverage on Maryland Health Connection. The only thing that would be important to note, you don't want to terminate it before you verify your coverage is in place with your employer. So you don't want to have a gap in that coverage.
Great. Thank you, Michelle. Let's see. For open enrollment, do you know if the local navigator offices will be available for walk-ins, or will they be meeting with people by appointment only?
I can address that a little. We have both options available. And if you go to our website and look at their hours of operation, there will be walk-in as well as virtual appointment. And I think all offices are required to have some walk-in availability.
Thank you. Can you purchase a dental plan only? And we have one question from Maryland Matters. This year, the exchange announced high numbers of new enrollments during the Medicaid unwinding period. As that process ended earlier this year, what enrollment trends does the exchange anticipate this upcoming enrollment period?
Let me take that again.
Yeah, let me repeat that question for you.
And I'm reading it, so I've got it. Do you want to repeat it for the audience?
Yes.
Okay, so the question is, the exchange, we had a lot of high enrollments that we attributed to the Medicaid unwind period. And as that process ended earlier this year, what enrollment trends does the exchange anticipate the upcoming open enrollment? And so there's a couple things. Although the public health emergency is officially ended, we are still seeing some reconciliation of folks that we're working through to make sure that they're moved off. We did this over a full year time, but we are seeing a little bit of that tail through the end of this year. So there still will be folks rolling off of Medicaid, certain segments through the end of this year. We again anticipate, the strength of the young adult subsidy alongside the tax credits has really helped grow enrollment, especially in that segment. We'll continue to focus on that segment. We've continued to see double-digit growth in both our Black population and our Hispanic population, and we will continue to focus our efforts there. So I think the only thing not different, we do this every year, but again, we're really focused on, we call them our micro areas, and we look at by PUMA data, and PUMA is, you have your zip code, but then you have the PUMA, which actually looks at population of 100,000 people make up a PUMA district. So we've been able to look at that small of a level to see where the uninsured are. And again, we'll focus resources in those areas where we know that the uninsured rates are still high. And we have identified that Montgomery County has, still has a lot of uninsured. So again, that will be an area we're focused on. But every year we look at where are the needs and where, what are the areas that we still need to put more effort in. So that's what we anticipate. I'll just add one final thing. We have seen, even though Medicaid enrollment numbers, the PHE is unwind has ended, we still see tremendous new growth coming in. Our growth has been really significant year or month after month this year. Usually you see it trend downward, but we've seen it trend upward. So we're hopeful we'll continue in that trend.
All right, and being mindful of time, we have just 1 more minute left. I know we had a couple people from the media on the line, so please feel free to reach out to myself or Betsy Plunkett, who's also available. We can get you a quote if you need it for your article. And I'm gonna just add my email again back into the chat. If anyone has any questions or you would like to work more closely with us, I'm happy to support you or get you where you need to go. Anything else to add from the excellent, well-esteemed speakers today?
Jenny, just one question, because there's still some additional questions in the chat. Are we able to provide answers and send those out?
Yep, we are happy to do that. If we didn't get to your question, please shoot me an email so that we can look into your question and we will get back to you today with an answer.
Thank you.
Let me make sure I put my email into everyone. I think I just sent it to Betsy. And yes, the presentation was recorded and we will be sharing it out later today. All right, well, thank you everyone again for joining, and thank you to our speakers. We really appreciate everyone's time today, and we're looking forward to a wonderful open enrollment.
Thank you.
Bye-bye.